And hello, Toronto, hello, Ontario, hello, Canada, hello, world. Welcome to Vantage's venue here in downtown Toronto, Ontario, in Canada. Good morning to you if you're in this region. Good afternoon to those of you who may be watching overseas. I would say good evening to those of you who are watching in various parts of the world. So excited that you're with us for what is a remarkable announcement that will be made here today. My name is Rod Black. I'm a sportscaster, broadcaster in Canada. I'm used to being around big events, and today I consider this a big event. And in my sports parlance, I would consider what we are about to talk about as being a game changer. Now, you don't have to take it from me, but we have a lot of experts and a lot of people who are going to talk today about this new breakthrough in medicine, an amazing breakthrough that is going to be able to help so many people and has already helped so many people, and I would include myself in that. We'd like to thank all of the outlets from around the world that are watching right now. Again, we've got you for about an hour. We have a lot of experts. We have a lot of people talking about, and a word that may not be in your lexicon right now, but something that will be used a lot probably in the future is the word Steriwave. Now, what is Steriwave? And for many people, as you know, we are at the back end, we hope, of what we've gone through the last couple of years in the pandemic. And of course, we have all suffered through COVID. We have lost people. We've lost millions of people around the world. And today we can honestly tell you that we have an announcement to make that may have been a game changer then and is going to be a game changer down the road. I want to tell you about the press release that maybe you could just put up one more time for me. The announcement coming from Vitae, which is a Latin term. I didn't do well in Latin in school, but it does mean light to life. And I'm not a doctor and I'm not an expert. We have experts to tell you about, but what we can tell you is anybody who knows anything about viruses is that they honestly are spread and come through the nose and the nostrils. And this breakthrough, Steriwave, is a light therapy that basically cleans your nose, decolonizes your nose, and it has had amazing success, especially around the coronavirus. The second paragraph in today's press release says this Steriwave treatment is the only antiviral treatment in the world that prevents the transmission and spread of COVID-19 when used according to protocol, and that can also be used to treat COVID-19 positive individuals to reduce systemic progression of the COVID-19 infection. That is huge news. And I know there are probably members of the media, members of the press, that includes me, that probably goes, what? Say what? We're here to give you some answers. I'm going to be your air traffic controller. I'm hosting today. We have people, again, from all over the world. We have some experts here. And we're going to start by going via satellite to our first guest, who is not a doctor, but he probably could be. He could be anything he wants, because anybody in Canada knows this man as one of the true Canadian sports heroes. He is a Hall of Famer. He is a champion. He's a champion for many causes, of course, and he's actually recently celebrated another Grey Cup victory here in Toronto. He was the guy that kind of reached out to me a long time ago to tell me a little bit about Steriwave. And trust me, folks, I am now a believer. But to take us through more about Steriwave and what it's done for him, please welcome the guy they call Pinball, Michael Clemons.
Let me get on mic first. Thank you so much, Rod, and thank you for that very generous introduction. I do want to say that I am not the expert, but I am the guy who has experienced it. And so that's what I'm really here to talk about, is my own experience. When I first heard of Steriwave, I was on a call with Dr. Jack Kolenda and others. All of these professionals were on the phone, and they were talking about what this could do. And we say it's the only thing that, I don't know about only. All I know is about this one. This is all I can really speak to, right? But the thing that I came away with that initial conversation was that, and I want to go through 6 points, because in I play this game called football, and you got to get a touchdown, and the touchdown is 6 points. But I'm going to keep us on schedule. I'm going to make sure that we stay on schedule here. So the very first thing is I realized that it was a standard of care at Vancouver General Hospital, and it had been used as a standard of care for 11 years already with no negative indications. So number one, I understood, hey, if this has been used for 11 years in very serious surgeries, including spinal surgeries, well, this is a good thing. Nothing bad is going to happen to me if I do this. This has been used 11 years and used consistently, surgery after surgery, as a standard of care. Nothing bad will happen if I take it. That was the very first thing. And then number two was then it was actually used as a safety device and to reduce the MRSA and staph infections and other infections, and it took those down to almost zero. And so when I say, okay, nothing bad's going to happen, and not only that, it's actually a safety device. And number three, they've been using it for 11 years. And in this 11 years of history is proven to kill pathogens. Pathogens is what I came to understand that COVID-19 is. And so it is one of these pathogens and maybe not as difficult to even kill as MRSA and staph infection. But for me, the idea here was, one, nothing bad is going to happen. Two, it's actually a safety device. It's to protect people. Three, there's 11-year history behind this, right, where it's been successfully proven to do this job and save Vancouver General Hospital millions of dollars. Not only that, then, I also find that they didn't have to adapt the treatment. Rod just talked about it being used through the nose, and I would have never thought about that being the first place something comes into your body. I would think if you got staph infection somewhere, you treat that directly, but you actually treat the nose, that nasal area, to try to keep things out, not trying to treat it afterwards. And so number five is it's non-invasive. Many of the things that we took during COVID, we're not sure about what could be other challenges that might be ahead of us. But this is a non-invasive light therapy, and light therapy is growing more and more. Number six, I used it in a preventative way. My biggest thing is I see a lot of people every day, including during COVID, including being around the team itself. But more importantly, in public, I didn't want to ever compromise someone else. I didn't want to be out somewhere and pass COVID to someone else. So I used it mainly as a preventative device. On a weekly basis, I used it once a week. And so those are my 6 points. And I've known to be verbose, so I can't just stop at 6. We have the extra point in football, and the extra point here is I believe in it so much, and I've used it and seen it keep me healthy. But I've also seen it actually help other people who actually have COVID. That includes my own family. Every member of my immediate family has used Steriwave. Players on our team, our players on a request basis know that they have access, and several of our players have used COVID with no negative situations happening and a lot of positive. And so that is my touchdown. Nothing bad will happen. It's a safety device. It has 11-year history at Vancouver General Hospital. They didn't have to adapt the treatment. It's used the very same way. It's non-invasive. I use it preventatively as not to, hopefully not to ever affect anyone else. And I believe in it so much that my family, players, and friends use it. Thanks, Rod. Appreciate it.
All right, Michael, before you leave, how about a quick question for you? when you think of Steriwave and what it's done, take me from when you initially found out about this treatment, this light therapy treatment, and what you've gained and what you've gleaned to now. Take me on a scale of 0 to 10, where you were and where you are.
Where I was, because I like to believe in people, I was probably a 2.5. Right? Because you had to be a skeptic a really serious skeptic, I think, to evaluate it in the proper way, right? So you needed to be critical, but I didn't say 0, right? I was probably 2.5, and now in terms of its safety and effectiveness, it's a 10 for me. I guess the only thing is I say a 9.9 because you can't say that if you use this, you'll never get COVID. That's not true, but it will lessen the impact. It could potentially can, in some periods, it has shown that you can get a negative test after using this. You can come up with a negative test, but a negative test usually means there's a minimal amount. So the one thing I still will say is that you still need to do responsible things, like wearing a mask in certain situations. If we were, if we had a situation where we were back in COVID. I would say a 9.9 in its safety, and nothing ever really negative taking place except for maybe a runny nose, and then the fact that it's been now proven to reduce these pathogens in COVID as well. We already knew that it did that in other cases, but we couldn't be sure in COVID until the testing, and now the testing, which you will go on now in this period and talk to the really smart people who will tell us how great and wonderful this is.
Yeah. Well, Michael, thank you. And you're one of those great smart people. You may not be a doctor, but thank you for being with us today and sharing your insight into it. And I think that's how many of us, including myself, and during this conference, we are going to be able to chat to another former professional athlete who also found great benefits from using Steriwave. So we'll have that. And also, if you have the press release, and you've seen the press release now distributed worldwide, you also know that the rock band, the hottest band in the world, who is on their final road tour, KISS, has been implementing Steriwave treatment over the last couple of years, and it's been able to keep them on the road, keep them healthy, and continue to play, and they will continue to play moving forward. We're going to chat a little bit later about that. But one of the reasons, probably the main reason that we're here talking about this today, is because of the man I'm going to introduce from Lux Vitae. He is an ENT surgeon, director of the Verso Surgery Center in Oakville, Ontario, medical director of Lux Vitae worldwide. Again, probably more responsible for any of us being here today. I'd like to welcome you to Dr. Jack Kolenda.
Thank you very much, Rod. Really appreciate the introduction. So I'd like to give a sense of the journey that it took us from point A to where we are today. And just to give you a background of essentially what has been happening. I think you have to realize that bacteria, parasites, viruses have always plagued mankind. And until the invention of penicillin, that's when we were able to treat people that would otherwise die. And over time, I think we've developed a false sense of security about those medications, because those medications no longer work as well as they used to. And that's because viruses and bacteria, they always change. And I think most people didn't think about how an infection can influence their lives until COVID happened. That was a huge, huge impact on a lot of people. I know a lot of people here probably had a loved one who they've lost because of this disease. But my journey didn't start with COVID. My journey actually started with a patient that I was looking after in the public health system who developed an infection called Candida auris. And before COVID, Candida auris was actually making a lot of news. because this is one of the most deadliest funguses that you can get. And the mortality rate of that disease is actually anywhere between 30 to 60%. That's a huge mortality rate. And so unfortunately, this patient succumbed to the disease. But what I wanted to know is, was there something else that we could have done? Is there anything else that exists? And so what do? As scientists, we look for information. And so that's what I did. And I came across this company called Ondyne. And I thought, oh, that's got to be an American company. And I was pleasantly surprised that this was a Vancouver-based company. And so we had initial contact, and they had data that essentially has shown that their technology does work on those infections. And as a surgeon who owns a private surgical facility, I was also interested in the effect of prevention of surgical site infections. A lot of patients who undergo surgeries are obviously exposed to bugs throughout the transition through the surgery. And so we do the regular things, but given that there is an increase in antimicrobial resistance, you need another tool. And that tool is photodynamic therapy, which I instituted in 2019 for my patients undergoing surgeries through my surgery center. And that has been a tremendous benefit to my patients. And then COVID-19 happened. And so when COVID-19 happened, as you remember, everybody was panicking. We didn't have all the information. We certainly had plans for immunizations, but nobody knew when that was going to happen. We actually had no treatments to speak of. And during that period, unfortunately, my mother-in-law died because of COVID-19. And that obviously had a huge impact on our family. And the one thing, it was the issue of being helpless. We couldn't do anything for her. Her physicians couldn't do anything for her because there was no treatment. At that time when I was running my practice, all of my staff was afraid to come to work. The fear was everywhere, and I had to come up with a method of trying to protect my staff. And so I reached out to Nicholas LaBelle, who is the scientific director in Ondyne, who's a brilliant man, and I asked him whether or not there was any data to support the use of this technology for prevention of COVID-19. And the answer was yes, there was in vitro data to support that. And that was very reassuring. We know that this technology has an indication for wide spectrum decolonization of the nose. And so COVID-19 is just another virus that we can treat. And so at that time when I instituted it, I essentially gave my staff and my patients that were going through the surgical process a protective mechanism against COVID-19. And it worked. It built a moat. Because if you remember at the beginning, we didn't even have access to testing. And so not having the access to testing and not knowing who is going to bring it into the clinic was very important, because obviously that will affect the day-to-day workings of the clinic. And so by instituting a regular twice-weekly treatments with PDT, we're able to essentially build a huge moat against COVID-19 in our practice. And then I thought, well, how can we use this to essentially to the benefit of patients? Because at that time, again, if you develop COVID-19, if you showed up to the hospital, if you had minor symptoms, you were told to go home and just kind of write it out and see how things will come up. And if you got worse, to come back. Well, with any viruses, with any diseases, usually we're used to taking something even when it's mild. So we want to prevent this from progressing to a more severe form. And so we had the idea of developing a clinic where we could test patients and then offer them treatments. And so we were able to, our initial data consisted of 37 patients, and we were able to prove that these patients who are presenting with minor symptoms, we're able to seroconvert them to being negative, and we're able to reduce their disease progression so they wouldn't show up to the emerge. And that was huge. And so with the corporation of Ondyne Therapy, we needed to get the news out to other clinicians But, you know, clinicians, scientists are skeptical. And so you need proof. And the proof that we needed was a randomized controlled study. And this is how Joseph Argemi played a huge pivotal role in providing the data to suggest and prove that this is a viable solution. It's another barrier in disease progression for COVID-19. And now, as a medical director of Vitae, we're hoping that private enterprise, institutions, will take a look at this. Because again, when you're dealing with any infection, you need a number of barriers. I like to call it the Swiss cheese model. You know, each slice of the Swiss cheese has a hole in it, but if you stack up all the different slices, it gives you a significant barrier. And I think that's the key. And I think that I'd like to open people's minds, other clinicians, or the scientists, that can take our data and run with it. And I'm hoping that private enterprise will use this data, will use our experience to increase their productivity. I mean, if you're sick, you're not going to come to work, private enterprise loses. If you're a patient having surgery, I think it's key that you can provide a treatment that will reduce your risk of infection. Not only would that benefit the patient, but it benefits the system. And we know how strained the system is. It's under extreme strain in all countries, not just Canada. And so I think that this needs a really careful look, and we're convinced, but hopefully other people will be able to look at this in a different light after this conference.
How would this have changed had this been implemented, used during what we went through?
I mean, it's hard to go back in time, but I think with the data that we have, I think certainly it would improve patients' outcomes who had minor symptoms. And the question that I have in my mind is, those patients that had minor symptoms and they went on to develop more severe symptoms, what kind of impact would this have had on the reduction of long COVID symptoms for patients? Mm-hmm. So we will never know. But, you know, going back in history, and you always learn from history, you know, everybody is aware of Spanish flu 1918. But a lot of people forget that there were other waves that happened in 1957, 1968. So yes, we've gone through this tremendous upheaval, but let it be known, we don't know when COVID-19 is going to resurge again.
Or what's next.
Or what's next, exactly.
Yeah. We have so many other guests, but I do want to ask you, because I'm sure the big question is, what is this therapy? How does it work?
So Nick LaBelle probably will be the person to answer this best, but essentially what it is an application of a photosensitizing chemical, which is methylene blue, which has an extreme long history in use in medicine, and combining that with essentially certain wavelength light, which excites the methylene blue to produce oxygen radicals, and oxygen radicals then destroy viruses and bacteria. That's essentially how it works.
You put it on your nose. How long would it be for? And it doesn't hurt. There's no side effects?
There's no side effects from this, aside from maybe a minor irritation or a runny nose. It's extremely safe. It has a proven track record in terms of safety. In terms of its use, again, it's a topical application that is done. It can be administered by a health professional, or it can be self-administered. And certainly Doc can speak to their experience in terms of using this therapy.
Doc McGhee, who's from KISS, who's going to be talking with us. Thank you. I know there's going to be some more stuff that we're going to lean back on you, but thank you for this.
No problem.
Thank you for bringing Steriwave to a lot of people, and we'll talk to the people from Ondyne as well who have done so much through the years. You mentioned Dr. Joseph Argemi, who conducted those trials of Steriwave treatment. He's at the University of Navarra in Pamplona, Spain, which is a few hours ahead of us right now, but we're going to bring Dr. Joseph Argemi in.
Hello, good morning to Canada. Good afternoon to Spain and Europe. Very happy to be here, and I'm very grateful to Online to have the opportunity to deliver this technology to our patients. So I will say Michael has mentioned especially the absence of secondary effects of this treatment, and Jack has pointed out how this treatment helped to some patients in isolated, let's say, series of situations, but clearly a clinical trial was needed. A clinical trial, for those who do not know what is the way the science evaluate an intervention. So if you want to know if an intervention is efficacious, you need to compare that intervention to a control arm in the same situation, both groups, and see if there are differences between these two groups of people. This, of course, is expensive, is difficult to perform. You have to select very well the population you want to target. But we needed that, especially me. I'm very skeptical. I'm also a scientist. I devote my time both to science and to patients. And I wanted this not to be, a joke, but just to be something meaningful for the patients. And we had this problem in our clinic, in many hospitals in Spain during all COVID and post-COVID pandemic, is that not just the patients that were affected by the virus with the worst consequences, but also all those amount of patients that were unable to perform their surgeries to undergo surgery because they being positive in their PCR testing. That was dramatic in some cases. We are talking about liver transplant recipients that couldn't do their transplant because they were positive in the PCR testing. So we were a COVID-free hospital. So we didn't want to have the virus within our walls. We actually did it. So we didn't have cases of COVID expansion in our hospital, but that means that you have to send back home all those patients that were positive in the testing, even if they have no symptoms or just mild symptoms. So this is why I was personally very interested on the concept of decolonizing the upper airway. And that is when Online came to me through a very good friend, Stephen. And then I talked to also Dr. Kolenda at that time. And especially in the sex wave of COVID-19, which is the Omicron virus, it was, causing upper airway symptoms more than pneumonia. So that was the best scenario, to test this technology. We did finally the randomized clinical trial with the enough power to show that the infectivity of this virus is completely reduced when you apply this treatment for 3 days. And because I was skeptical about the efficacy of this treatment, I suggested a strong endpoint towards the negativity of the PCR done in the whole upper airway, not just the nose. And actually, it was very unexpected finding and very surprising that we saw that the amount of virus in all the respiratory tract was diminished, but just treating the nose. And then scientifically, we have explained this in a scientific paper published last month. And we think that this is because the reservoir of the virus is in the nose. So once you have eliminated the virus from that original site, then the possibility of getting the infection to the rest of the airway is hugely reduced. Another surprise that we got is that the immunity somehow the long-term immunity. So we have measured the immunity against COVID-19 at 10 and 20 weeks after this the treatment. So it's very far away from the treatment. It's affected. So instead of going down the road like in any patient that the immunity little by little decays over time, we saw stabilization of the immune response. So that's something that deserves more investigation, large cohorts, but that's a huge, in my opinion, it's the most interesting finding. So it seems that somehow treating the nose with this technology enhances the immune response against the virus. This is if this is confirmed in large cohorts, it will be absolutely a breakthrough discovery. So I just wanted to say these two things. I'm very happy about this collaboration that we have been undergoing. We are happy here in the hospital. We are seeing every day new applications of the decolonization of the nose using a Steriwave. And yes, I think it will be very relevant for different situations, not just COVID-19 in the future.
Argemi, who is in Pamplona, Spain today. We're going to move now west of here in Canada. We're going to go to Winnipeg right now with the former head of communicable diseases and zoonotics for the province of Manitoba, director of the Pure Clinic in Winnipeg. I'm going to call in Dr. Richard Rusk right now. Good morning, sir.
Yes, good morning, everybody. Can you hear me okay?
Mm-hmm.
Great.
Perfect.
So, so quick background on myself. As you said, I'm a physician in Manitoba, and part of my background is I actually was a veterinarian as well, and my subspecialty is, as a physician, is public health. And so for this pandemic, we definitely were in a pickle in that first year. As has been said before, there was no vaccine, there was no treatment, and essential services needed to be kept going. How do you keep fabrication going? How do you keep big factories open when you've got a virus that spreads this rapidly? And part of my public health work was with bigger corporations. And so that was more in focus on how to ensure that everyone's using a mask correctly and kind of the classic public health approach. However, when there was one particular very innovative company that did approach me to try and implement this new technology, and much the same as the previous speakers, I also was quite apprehensive. I was very skeptical, and yet I saw it was vital. We had no alternative. Otherwise, we could lose huge parts of industry. And so following a precautionary principle and definitely taking do no harm as my foundation, we implemented mass preventative treatment on a weekly basis to around about 1,500 employees for a year. Actually, it was a little bit longer than a year, but the bulk of the treatment was for a year. And so we treated, we had over 50,000 treatments, and our findings were astounding. It really was quite unexpected. Unfortunately, I can't go into the exact numbers because I've already submitted this information for publication, so it's embargoed. But I can say that this was a statistically significant finding, and as I'd said in the beginning, I was coming from a do no harm approach. So I was ready to turn this off as fast as possible if we were seeing any harm. And it was astounding. We were not seeing significant side effects to this. So we were establishing a safe and effective treatment on a massive scale. And it definitely has changed the landscape. And this is, it's been mentioned before, we really hope that industry will notice this. But essentially, I've proved that this is a cost-effective preventative treatment for industry, where especially you have high congregation populations. The piece that I really feel is much more important, though, is something that Pinball brought up right in the beginning, that this technology has been around for years already, and it's been focused on prevention of antimicrobial resistant treatment. And if I, as a public health physician, if I'm looking forward, we may be behind, or we may have got through COVID, but the juggernaut that's really going to impact humans in the future is going to be antimicrobial resistant bacteria. And this technology has already been proven for that. So what we have brought to the additional scientific literature is an effective and a safe treatment. And using it as a preventative treatment is going to make that difference to the future. And so what I'm really hoping that we can achieve through this and through ongoing education of other clinicians and general public is we have a potential of using something that is not it's not antimicrobial based. It's not a medicine that is going to create resistance in the future. We already have something that has shown that you don't get antimicrobial resistance through use of this. And so prevention for those surgical infections, for more complex, like Jack had brought up, Candida auris. Anyone in the infectious disease community will know that is incredibly frightening pathogen coming down the pipe. And yet we have a technology that can address this. And so I believe it's very important that this sort of information is spread and hopefully started to be utilized. So.
Much. Just one more thing before you go. I know you have some embargoes, but what are the industry leaders that you've been working with saying about Steriwave?
Yes, so I have used this not only in my clinic and for a selected group of patients, but also on a broader scale. And all of the industry companies that I've used this with and discussed this with have actually been quite open. The simple reality is at this point we have to work out what is that cost price, but that is going to allow widespread implementation. But we also know there's obviously going to be an improvement in cost to these sort of prevention treatments. And then if you go back to broad medical economics, there has never been a product that has been focused on prevention that has cost more than actual tertiary treatment. And so at the end of the day, this may cost, but it does save. And it not only saves money for industry, but it saves lives.
All right, thank you to Dr. Richard Rusk, who is in Winnipeg this morning. Continuing on with our experts, perhaps no more leading expert than someone who knows a lot about infectious diseases and viruses, a man who was key in creating and developing the drug AZT, the first antiviral in the world to fight the AIDS infection. He has been awarded the Commander of the British Empire for his contributions to medicine and humanity in the world. He comes to us from London, England this morning, which is the afternoon in London. So we say good afternoon to Professor Trevor Jones.
Thank you, and it's a pleasure to be with you all today. You've heard that obviously infectious diseases have got a major impact on human life, but not just that, but the cost of delivering healthcare. And I think what Steriwave is doing is gradually getting to the point where we can see a cost-effective solution that we just heard from Richard is in addition to the human aspect of that. Now, I've spent my life, as you heard, in developing new medicines, especially for infectious diseases, and more recently advising the British government and the G7 ministers on the current pandemic and, very importantly, future pandemic preparedness. And one thing is for sure, that there's no one-size-fits-all approach to this. We need different approaches. We need drugs for antimicrobial resistance. We need new vaccines that are pan-coronavirus. In fact, I'm working on one with my company in California. But we certainly need these interventions that Ondine have produced. Now, you know, you've heard from several people so far that we scientists are pretty skeptical people. And testimonial evidence is fine, very interesting. But in the end, I want to see scientific data. And we've seen it. We've seen it from Dr. Argemi. We're going to see more from the work you've just heard on. And the fact that this product's been used very successfully in hospitals in Canada to treat hospital-acquired infections. And what my mission is with others on this call is to try to get this then much more broadly spread. But it starts with the data. And once you've got those data, we can then show hospital authorities, industries, and so on, that this isn't just hearsay, this is real. And we're going to hear, I hope, from Caroline and Nick later of maybe some of the advances they're making in the technology to make it easier for individuals to do this, rather than it be, at a particular location. So, coughs and sneezes spread diseases, and we know that this data that we've seen from Navarra, which is great data, shows that, not only does it change the course of this COVID infections, but increasingly this business to potentially affect the immune response could be very significant, and again, for pandemic preparedness and not just for the treatment. So, folks, I'm very much a fan of this because it's based upon good, solid data. And we know it's effective, we know it's preventative, and we know it can use for treatment as well. So those aspects are really important. What we now need to do is to get this technology more widely adopted, and especially in the various healthcare authorities in North America, in Europe, and in the wider world. And I think we're at the start now of something really important.
Thank you to Professor Jones. Thank you so much for joining us today and your words. And data rules. That's the main thing. We're going to stay here in our room now. We talked about industry and business, of course, and how important that is to not only saving lives, but also the cost that goes along with the workplace. I'm going to bring in the business representative of the International Brotherhood of Electrical Workers, who's with us today, Joe Marcello. Good morning to you.
Good morning. And let me start off by saying that it's an honor to be here amongst all of you. I truly believe that this is a special time and date for us to be speaking about this. 2 years ago, April of 2021, my wife and I both became infected with COVID-19. At that time, you know, we still have 2 children. They were at the ages of 14 and 12. It was a very, very scary time in our lives. You know, no one really knew how to cure COVID or what to be given when you're infected with COVID. Luckily, someone from our local union introduced us to Steriwave. My wife, more so than myself, she's asthmatic and started to become very ill. We went to the clinic to get treated, and within 3 days, we were on our way to a pretty quick recovery. I was very concerned, not only for my wife, myself, but for our children. Steriwave treatment helped us to the point where I can say it may have saved our lives. My other primary concern was my children, and they would get it. My children were treated along with us, and they did not contact COVID-19. Now, let me explain something in regards to my children. They're my life. My daughter has many allergies, and we were very nervous about receiving the Steriwave. I had the pleasure to speak with Dr. Argemi from Spain while I was being treated and was reassured that nothing was going to harm my daughter in the sense that with her allergies, and I'm glad I listened. After we were treated, I became so happy that I went to the Steriwave and received that treatment. I just started telling the world, hey, everyone, listen, there is a place where you can go if you do get COVID. It's not invasive, and it does help. One of my dear friends, a co-worker of mine, has a son who is who's severely immune compromised and was very, very sick. He was going to be admitted to the hospital. His parents were frantic. They all came to the clinic, and their son was treated for 3 days in a row, and then followed up with more treatments over the next week. It was almost a miracle, and him and I still talk today on what we went through 2 years ago. Their son began to heal and was never admitted to the hospital and fully recovered within 2 to 3 weeks. His parents were treated, and they recovered quickly. Now, we know it is safe. It is painless to use, and we know that it's used at Vancouver General Hospital. My question, not only to this room, but to the world, is this incredible treatment not being used in Toronto? Why isn't it being used in Toronto and every hospital in Canada throughout the world? Why is it every frontline healthcare worker not being offered this life-saving treatment? I want to thank the real heroes here, Dr. Jack Kolenda, without whom me and my family and friends would never be treated. Dr. Argemi, and all the other doctors who have advanced this extraordinary treatment. And the first hero, Carolyn Cross, who has devoted her life to creating this company and treatment to help people all over the world. Once again, I'm honored to be here. I truly am. And I'm very grateful to be one of the first to receive this Steriwave and to be able to help my family through this troubled times.
Thank you, Joseph. Again, that's a real-life testament to how Steriwave has changed people's lives. So thanks to you, and I know that is a very valid question. I know we'll be asking that question for a while. Carolyn's going to be joining us from Ondine a little bit later to talk more, again, about how this first developed and where it's going to go. But let's stay with the health practitioners and the people who are on the front lines, more heroes, especially over the last couple of years. In our room, we have a former instructor of nursing at University of Toronto and the nurse manager at KW Hospital in Kitchener, which is now the Grand River Hospital, and we welcome Elizabeth Quinn. Welcome.
Thank you. I'm delighted to have the opportunity to share my experience with Steriwave. When I first heard about Steriwave and that it had been approved by Health Canada more than a decade ago, I felt quite comfy tucking this away in my arsenal for future reference should I become infected with COVID. As a nurse, I knew that various forms of photodynamic therapy, meaning light therapy, have been used for decades in hospitals to treat newborns, to sterilize environment surfaces, air, water, and in some cancers as well. I'm in the very high-risk demographic. I was 72 years old at the time, managing for 19 years a chronic cancer scenario, and I have no spleen, which is a vital part of one's immune system. Not only am I chronologically elderly, with emphasis on the word chronologically, I'm also immunocompromised and immunodeficient. I was concerned how I would fare if I was to become ill with COVID and was very disciplined in managing my potential COVID exposures. But I'm also human, and I succumbed to the desire to gather the family. And my husband and I hosted what turned out to be a family super spreader event. Upon testing positive, I immediately called Dr. Kolenda's clinic, and within a mere 2 or 3 hours was undergoing Steriwave treatment along with my husband. We did treatments every day for 5 days. This was my COVID experience. On day 1, I had a temperature of 38.5 for 2.5 hours and 1 very runny nostril. Other than that, I felt completely normal. On day 2, my stomach felt a little yucky if I was doing physical labor, so I just did computer work and I felt, again, 100% normal, other than the 1 runny nostril. On day 3, preparing for a renovation, my husband and I were moving heavy furniture into the garage when he turned to me and said, "Not bad for 2 people in their 70s with COVID." Contrast that to the other 16 members of the family at the super spreader event who either had already had COVID, got it again, or got it for the first time. Collectively, they experienced things like diarrhea, sore throats, coughs, prolonged high fevers, feeling ill, and staying in bed. In spite of our age and our significant comorbidities, my husband and I experienced very mild disease and a stunningly surprising quick recovery. Too few hospitals in Canada have adopted Steriwave. Some may feel there's insufficient data. After today, they can't say that. But to them, I would say a few things to those who are skeptical. Don't let your training interfere with your learning. Extrapolate from the 13-year-old data and consider the information we're getting today. There is a principle called duty of care, which when superimposed upon the workplace means that there's an obligation on the part of the employer to protect its workers and ensure a safe environment. You heard Dr. Kolenda take steps in his own workplace to ensure his employees were safe. In Canada, employees' rights to a safe work environment in any industry are enshrined in statutory law. I'm going to repeat that. Employees' rights to a safe working environment are enshrined in statutory law. Like all employers, hospitals are legally obligated to ensure frontline healthcare professionals and other hospital workers' environments are safe. We lost far too many healthcare professionals at the height of this pandemic. Know that this is now a preventable tragedy. But it's not just hospitals. Our first responders are highly vulnerable as they enter homes and deal with members of the public who are not PPE'd. Not only does Steriwave treat infection, it prevents infection and has been demonstrated to be effective, as we've heard, as a preventative modality in the workplace. I implore all leaders, including but not limited to various healthcare agencies, our long-term care facilities, our hospitals' infection control departments, and hospital risk managers, as well as our union safety stewards, to take appropriate first steps. Simply start by reaching out to Ondine to learn more information and discover how this can be incorporated into your organization. On a personal note, I want to thank Dr. Jack Kolenda. You didn't know it, but you were my white knight in shining armor. Given my medical history and having COVID, it could have turned out very, very badly for me, so I can't thank you enough for your dedication, your commitment, and your vision. I'm also grateful that I live in the Greater Toronto Area, which is the only place in the world that an informed and proactive person such as myself was able to receive Steriwave treatment. And I would surely hope that after today, that's about to change.
Elizabeth, quick question for you. I mean, when you went through all of this, you obviously had to talk to colleagues and other nurses and doctors. What was their reaction when you mentioned to it, if you did mention it to them?
Well, I'm not working. I'm 73 and I'm retired, but I did mention it to my family doctor. I have several naturopaths involved in my situation, my cancer scenario, and I told everybody. And interesting. In fact, one of them is they've all received the link to watch this, and one of them is trying to watch it between patients this morning. So it is gathering attention, and I think for someone like me who is in that very, very high-risk demographic, to have breezed through this the way I did says a lot.
Yeah. Well, thank you for your story. Continued good health to you. You know, we're almost, I guess, at the 3-year anniversary of when our world really shut down. And it's my world, the sports world, where I'm a broadcaster, when I think, even though we had heard a lot in the media about the coronavirus, it took an NBA game to being canceled where everybody really started to pay attention when Rudy Gobert tested positive. And then the NBA shut down, then league shut down, then the world shut down. And I'm going that way because I'm going to talk to another former professional athlete who had a lot of success on the ice with the Toronto Maple Leafs, where he was a 50-goal scorer. He was a Stanley Cup champion with the Montreal Canadiens, and he was introduced to Steriwave over the last couple of years as well, and he has been utilizing it as a treatment. And we want to bring in Gary Leeman. Good morning, Gary.
Good morning. Good morning, Blackie. Great to hear your voice. Good morning, everybody that's listening in. It's truly a pleasure to be a small part of this big news. It's truly a great day today, and amazing speakers before me. Just learning as we go. This has been quite a ride. I'm obviously not going to be able to tell you any more than what these great doctors and scientists and nurses that have preceded me in this. But what I can speak to is my experience with Steriwave, and in doing that, I'll have to take you back a couple of years when a friend of mine who was involved with this clinic in Toronto mentioned to me, if you ever get COVID, there's a clinic in Toronto that can provide a treatment. And I was a little bit skeptical. I was a little bit surprised, to say the least. And I kept that in the back of my mind. Fast forward to approximately a year ago, I contracted COVID. And right away, I had a decision to make. And I had remembered what my friend told me. So I made a call, and thankfully, they were still doing it. And I was still skeptical, but I had two decisions. There was nothing else out there. I could, just ride with this, ride it through, or I could get proactive and check it out. So within hours, I was accepted. I traveled three days in a row to get 12 minutes of treatment. I was quite sick when I got there, and after the first day, I actually stopped declining in how I felt. The next day, I actually felt better, and from that time on, things had leveled off. There was obviously disease past the nose at that time, so it was up to my body to fight it, and it definitely stopped my decline. And but while I was there, I learned a lot about the treatment, and heard that the KISS rock band was actually traveling with it, and they were able to continue working. And for me, in my work life, I'm around a lot of people, and in close quarters, knowing that when you get treated with this, you're not contagious. You're basically doing your part in not spreading any disease. So I've become an advocate. I use it on a daily basis. I travel, I work, I feel confident that I can be around people, and especially immune compromised, the elders, and know that I'm doing my part. So I also feel that this could be very beneficial for sports franchises that every year there's days lost to players that get sick. It's a dog-eat-dog world when it comes to winning championships and whatnot. So, giving your players the best opportunity to perform as long as they can is something that I really believe it would be beneficial for athletes. I'd like to thank also all the people who had a role in the development of this treatment. Dr. Kolenda, for putting up his license for this is amazing. Dr. Argemi, who's put countless hours into and his commitment to this is outstanding. And Carolyn Cross, for her part in the development from Ondine. They're all really truly heroes. So thank you for having me. It's been a real pleasure.
All right. Thank you, Gary, and thanks for your story as well. There's nothing more poignant today than those personal stories, as well as you're getting to hear from the experts. And again, for those of you who are joining us, we're talking today about this treatment that is available, could be available, has been used in Vancouver. We'll talk to Carolyn Cross from Ondine a little bit later. We'll talk to Doc McGhee from the rock band KISS, who has been using this treatment over the last year to prevent the spread of COVID and to keep themselves healthy. And we're going to learn a little bit more as well. And I know we're going a little bit over time, but I do think this is very informative. So again, thanks to everybody here who's been involved. But the personal stories are those stories that really touch home. And we're going to have another one here from the CEO of Horizon Core Investments, a private investment corporation, a user of Steriwave to prevent the transmission and spread of COVID in his family. And we'd like to welcome Jay Derma here. Hi, Jay.
Hi, how are you? Pleasure.
Very good.
Thank you so much for having me in this opportunity. And for my fellow panelists, it's been a real treat here listening to your stories and everything like this, and I thank you very much. I'm here to tell you my personal stories. I've learned first about Steriwave from one of the closest and most special people in my life, and that is Mr. Gary Leeman, who just finished speaking. And we're very close and really good friends, and he's brought this to my attention when I got sick. And I got sick at a time last year when we just had, my partner and I had a newborn daughter at that time, and I wasn't able to be with my newborn daughter and my partner. Sorry, it's a bit emotional for me, but because I was that sick. I didn't end up in the hospital with COVID, but my finger was on the 911 button for the longest time, and Gary had been telling me about this treatment that I was skeptical of, and I wasn't really sure on how to take the news or take what he was talking about. So the treatment that he kept explaining to me, I wasn't able to, or I chose not to do anything about it until later on in the year, but I was suffering from long COVID, trouble walking, breathing, couldn't walk up a flight of stairs. It was just a nightmare for me. And when I finally had the opportunity to, the strength to say, okay, I'm gonna try this. This is getting ridiculous. Since August, I've been treating every single day, and I can inform you that my long COVID symptoms have disappeared. They are gone. And I've started noticing the differences in this within the first week of treatments. And my wife, my better half, has been treating every day alongside of me. And I haven't caught a cold. I haven't caught a flu. I've been healthy ever since, and I've been feeling better and better and better as time goes on. And I find that the long-term benefits of this are my allergies have subsided. My strength and I'm not in physically the greatest shape I've been in, but I feel so much better. And I have been in close contact as well, and this is very important, I think, that people should know, with COVID, heavy COVID, where a friend of mine recently, who has been very ill, with a high temperature of 104, sweaty, chills. I've been in direct contact with this person for a couple of hours. And I have a child now who is 14 months, but I'm with this person at home, hugging, be hanging out, and going home afterwards, treating myself every day, of course, going home afterwards and hugging my daughter, hugging my partner, putting my child to bed, giving them baths, as a parent, as a family member, to say that I have not contracted or passed anything on to anybody since I've been doing these treatments, being in direct contact with sick people. I can say this is truly amazing. And to Dr. Kolenda and Dr. Argemi and Mr. Lobel, and of course, Mrs. Carolyn Cross, like my panelist here told me, that you said that you guys are the true heroes behind this. And this is a huge honor. And thank you very, very much. I thank you from the bottom of my heart. Like, this has kept my family and everybody I love and care about safe. And that's all due to you. Thank you.
Wow. You take it every day?
Every day. I do not miss a beat.
And for someone who has had it, and again, it's helped my family, members of my family, and myself, I did find also it did help with allergies and sinuses in particular, because I had COVID as well, as most of us have had COVID at one time. But it is a little funky when you first get it done. It's
and it's right away you think to yourself, it's when you do your first treatment. And then people have asked me, it's like,
you got the blue light going?
The blue light going,
blue nose.
everything like this. You're walking around, but it's also a good peace of mind knowing that you are protected.
Yeah.
And the way it makes you feel afterwards, and knowing that I am not putting my daughter at risk, who is my world.
Yeah.
And my family is safe. My family is treated. I haven't passed anything on, and all I can say is this is the real deal, and this everybody in the world has to know about this, and I know that I'm confident that they will.
Well, that's great. Thanks, Jay. Thank you. So thanks to Jay, and again, the personal stories are everything, but of course, we're here today because of the experts and the fact that it also has been used. Jack, if it wasn't for the people in Vancouver, where you never would have heard about that in the first place. Again, we go back, there's a great connection here, that chain. So we're going to go to Vancouver right now for a moment, and then we're going to still get to Carolyn a little bit later, and again, kind of the true hero behind Steriwave, and Ondine. I'm going to bring in the past chair of the Vancouver General Hospital and UBC Foundation. Vancouver General Hospital is the home institution of Steriwave. They've been using Steriwave where no one else has been able to use Steriwave. And Gary Siegel is with us. And it is a very good morning to you, sir.
Well, thank you so much. Really, it's a pleasure to be here. Good morning, everyone. What a wonderful array of speakers we've had so far. And I am happy to be here to share a bit of a different perspective on all this. As the current past chair of VGH and UBC Hospital Foundation, I'm really proud to be here to speak about the pivotal role Vancouver General Hospital has played in the adoption of Steriwave as a preoperative treatment to stop hospital-acquired infections. Vancouver General Hospital is a center of excellence for healthcare for British Columbians and has been at the forefront of research on this innovative technology, illustrating its substantial benefit on health outcomes and reducing costs to the healthcare system. I am extremely thankful that our great VGH clinicians and researchers had the vision to be an early adopter and do the initial research documenting its safety and benefits. which is what you need to get a new game-changing treatment deployed. As a result, along with thousands of other surgical patients at VGH over the last 11 years, I also had it administered to me before I was wheeled away for emergency back surgery in May 2020, the very early days of COVID. Similarly, a couple of years prior, my wife had it administered to her before knee surgery. I'm particularly proud of the fact that our hospital has been a leader in this area, which has really helped pave the way for the conversations we're having this morning about this impactful technology, which has been advanced by Kellen Cross and her dedicated team at Ondine Biomedical, also a Vancouver-based entity. It is really wonderful to see local businesses and hospitals working together to improve healthcare for our community. But these things really don't happen in a vacuum, as you know. You also need the funding to support it. And as a board member and supporter of VGH Hospital Foundation for many years, I have seen firsthand the tremendous impact that our foundation has had on improving health care. And that's by supporting research and novel treatments. So this really is a reminder of the importance of funding research and adoption of advancements in healthcare, not only through our foundation, but others with similar mandates all over the world. Just look at all the global cooperation that's represented on this call today. This shows how through our collective efforts, we can continue to push the boundaries of medical research and improve the lives of patients everywhere. So I want to thank everyone who's contributed to advancing this important work and getting the word out, including all the doctors and lay people on this call today. Thank you.
Okay, thank you to Gary, who's in Vancouver. We're going to go back to Vancouver in just a moment to talk with Nick LaBelle and also Carolyn Cross. And I apologize to everybody. I know we said we're going to go an hour, but we've had such great stories and there's so much information here. And I know there are a lot of questions out there. And again, I would encourage all the members of the press and the media, whoever wants to ask any of those questions or get any interviews with any of the people here, we can set that up again through that line a little bit later. If you saw the press release today, that was that listed the announcement about this treatment, Steriwave, and in conjunction with Ondine and everything else about it. You also noticed the headline, and I don't want to bury the lead, that the rock band KISS has been using Steriwave for the last year and a half, perhaps, on tour. And we know how good they are. They're on their farewell tour. Personally, one of my favorite bands. I don't know about anybody else here. Yeah. They're not only the hottest band in the world, but they're one of the oldest bands in the world. And I'm sure that had a lot to do with using Steriwave and the fact that some people could be immunocompromised around them. I'm going to bring in the legendary manager of the band. He also managed Bon Jovi and Motley Crue. He has a lot to say about it. So let's head down to Los Angeles, California. I believe that's where he is. Doc McGhee, hello.
How are you? Thank you very much. So listen, first of all, I want to thank everybody that's on this panel as well, because, we all started very skeptical and not understanding anything because of our society and the way that everybody pushes everything on us. And when we start finding things out like Steriwaves, we have such a backlash of people that don't understand. So the educational process of this particular press conference, I think, will be one of the pieces of the puzzle to try to help unravel that kind of sense of, I don't know what this is, or how is it going to help me, or should I take this or not? I started this with the rock band KISS when Paul Stanley became infected with the coronavirus in Pittsburgh on our tour. Had nowhere to turn. I called some friends of mine in Los Angeles, infectious disease. Nobody had an answer. Nobody had any idea what to do except to call this company in Canada. So I called the company in Canada. I found Ondine. I found Steve. Went through it. Looked at some of the research that obviously you've been talked about today in this press conference, and we adopted it. I got the machine and started to use it. Obviously, people don't know what they like what they know. So it's very difficult to get people they go to their doctors and they say, what about Steriwaves? And they go, I don't even know what you're talking about. Well, it's a decolonization of the nose. And then they go, well, you can put a rabbit's foot around your neck or whatever you want to do, you know, and they kind of dismissed it all. And so but the real fact is we're all sick. And I have a tour. I have 130 people on the road moving every day. So I'm all of a sudden getting sick. I have to cancel 5 shows, 9 shows, lost millions and millions of dollars and plus had to reschedule all the dates, okay, for later in the year. But what was really disheartening for me is I was leaving people in hotels around the world. So when somebody would get sick and we would test them and we tried, there was no real protocol of KISS, or COVID when we started this. So when people got sick, we were testing, we were racing around getting test kits. I had the Steriwave machine. I set everybody down in my crew. I showed them all the research that I had. I said, here's the doctors. You can have your doctors call Dr. Kolenda, and he will go through it with you to no avail. People didn't want to know about it or was too skeptical of it. Okay, one of our very good friends and a member of the KISS kind of family for 20 years died of COVID on the road. Wouldn't take COVID, wouldn't take the Steriwaves, wouldn't do anything, wasn't vaccinated, we don't think, and wouldn't go to the hospital. So it's just a matter of this educational process that will help us get through all of this. So I just want to say that without this, we wouldn't be on the road. We couldn't have done the extra 100 shows that we just did. The biggest part about this was the fact of if we had somebody that contracted COVID, then what we would do is we'd treat them for 12 minutes and we'd do it like three times, 3 days in a row or 4 days in a row. But what we found was that without any real symptoms after the 12-minute treatment, they were non-infectious. So that if they didn't have fevers and stuff, they could go back to work, continue their treatment, and go on with the tour. So this was a huge breakthrough for us. My industry is slow to adapt, like all of ours. I hope today, with the help of Carolyn and everybody else here, this will change. Also, I guess the only thing I can say is, Gary, you were one of the first ones to adopt this for Vancouver. I've done 7 major records in Vancouver, so I've done a lot of work in Vancouver. My brother actually played for the Toronto Argonauts, though. But at any rate, so what we want to do, Gary, is KISS is going to donate 4 tickets, backstage passes, everything else for the Vancouver show for your foundation. So you can auction it off. We'll be doing it in October of this year. Be my guest. We'll bring them backstage. We'll introduce them to the band. They'll have a great time and hope to raise some real money for your foundation.
Wow, that is incredible. Thank you so much, Doc. That is really amazing, and we're going to really, I'm sure, be able to take a great advantage of that. It's going to be, you guys are just hugely popular, so I can imagine this going for a great sum of money that will just allow us to continue funding wonderful research that impacts healthcare in the world. So thank you, Doc. That is a wonderful surprise gift, and I really appreciate that and look forward to seeing you in Vancouver. When are you going to be there?
We're there in October. I'll get you the date.
Fantastic. Thank you so much. On behalf of the foundation and the hospital, thank you very, very much.
And I will be hearing from Carolyn, who actually started all this, and I'm just happy to be part of it.
Yeah, Doc, thank you. Any other tickets? Any other tickets out there for anybody? I'm just saying. We're all but hey, listen, I do want to ask you before you go, the reaction from the band, from Gene Simmons, from Paul Stanley, skeptical perhaps at first, but are they true believers?
They're true believers. They used it We use it every show day. We don't use it every day, but every show day we use it. Nobody's contracted it using the protocol that we've set forward of doing it on show days. So it's about 4 times a week out on the road. I use it at home. My wife uses it at home. As all of us know that's on this panel, everybody we know used it. Everybody that got sick, that were skeptics at one point, said, let me try it. I'm sick, my sisters, my cousins, and it seems like over the last year and a half, I'll bet you I've treated 50, 60 people myself, just outside of the band, just in COVID. It's been crazy.
You probably felt like a real doctor.
Well, I kind of did, but the big thing too is that COVID is just a byproduct of all this disease.
Yeah.
It's everything that goes in your nasal passage. So it's not just for COVID; it's for everything. So, but you guys will explain all that stuff.
All right, thank you to Doc McGhee, manager of KISS, their end of the road tour as they go across Canada, around the world, and they have been using Steriwave almost every day, and again, have not contracted COVID-19 or any of the variants, and it's been able to help them continue on and forge on. So now we're going to get close to ending, and we want to save the best for last, and that is the company that is really behind Steriwave, and that's Ondine in Vancouver. We're going to get to Carolyn in just a moment. We actually have a Steriwave machine here, and I know Dr. Kolenda and Jay will show us in a bit how exactly to use it and what it looks like. But I want to bring in the president of Ondine Biomedical and creator of the Steriwave treatment and chief scientific officer of Ondine Biomedical, and welcome in Nick Lobel. Good morning, Nick.
Thank you very much. Much appreciate the opportunity to speak with you. I'm going to be not quite as important as the luminaries on this call. I've really been touched by some of the things I've heard. Thank you so much to all of you for bringing time to this technology. We, of course, Carolyn and I have been doing this for 20 years, and we have collectively spent the bulk of our career in bringing what we think is such an important thing to mankind. I'll keep my comments brief. From our company perspective, I talk only about our approved indications. You'll hear me talk about this broad spectrum decolonization. But I'm going to just bring in a bit of a sober comment. During the hour that we've spent here, 2,500 people in the US have contracted an infection in a hospital. And of those, 250 will die from it. And the technology that you've heard about here was developed in and for hospital healthcare environments to eliminate the microbes and pathogens that cause surgical site and other infections in hospitals. With over 100,000 patients treated in Canada over the past decade, that's really the driving impetus for us. And doctors around the world are used to relying on antibiotics. These very old and extremely important systemic therapies that we well know. And unfortunately, they are ineffective against viruses and most fungi. And they've started to fail against bacteria, which have evolved antibiotic resistance. Bacteria tend to talk to one another in ways that humans can't, immunologically and biologically. And those bacteria borrow genes from each other, which allow them to evolve this very dangerous thing called antibiotic resistance, where we are starting to lose the antibiotic because of overuse and the evolution of resistance. So Steriwave is a light-based technology. It involves the combination of a particular dye, chemistry, and light, and it solves some of the core issues people have with antibiotics. It's very fast. It works in minutes. You've heard a lot of folks talk about several minutes of therapy, not days to weeks like antibiotics. It has no known side effects that are significant in a decade and over 100,000 patients. We haven't detected that. It can destroy viruses and fungi, unlike antibiotics. And of course, it doesn't produce resistance itself, which is extremely important. And so you have healthcare professionals, such as those on this call, advising us of their use against SARS-CoV-2. the virus causing COVID-19. Not originally a target for our company. We've spent a great deal of time researching in our in vitro facilities in near Seattle, Washington, how we impact that virus as well as others, the monkeypox virus, etc. But again, just one of the pathogens that this broad spectrum technology impacts. It's rare to find something that is active against fungus, bacteria, and virus while avoiding damage to human cells. And so with our partners at HCA Healthcare, we are now engaged in pioneering the transfer of the technology, the development in the US, and obviously in close collaboration with government agencies such as the FDA. And we hope to be shortly clinically trialing the technology in US hospitals to kill microbes in the upper respiratory tract that cause these surgical site infections, as well as other nosocomial infections. So just a few brief words there. I'm going to close by saying I see us as stewards of the technology for a while, but it's bigger and more important than any of us. It's bigger than Ondine as a company. We think this is for mankind, for the world. It is our responsibility to ensure that it's responsibly developed and scientifically so with a data-driven approach. So we very much thank the doctors and panelists on this call who have deployed the hospital-based technology we've developed in new directions. And we look forward to lighting up the world one nose at a time. Thank you very much.
All right, thank you, Nick. And stand by. I think we're going to do a little demonstration here after, and we'll get you to help with Carolyn through it. So we kind of are saving the beginning for the end, and we have talked about COVID a lot, but Steriwave was developed for surgical site infections and, of course, the MRSA virus. And from that, we have developed a completely new chapter, and a chapter moving forward that could produce great results for so many people. So I'm going to bring in someone who has had so many things given to her through the years. Her life story is absolutely amazing. She's the CEO of Ondine Biomedical Inc., former member of the National Research Council of Canada, board member of the Canadian Foundation of Innovation, and a recipient of the Meritorious Service Cross by the Governor-General of Canada. Sorry that you had to save it for last. We wanted to save the best for last, and she is truly the reason we're here today. And we say hello and good morning to Carolyn Cross. Oh, do we have Carolyn?
There we go.
There we are.
Good
morning.
Good morning, finally. Thank you so much for those very kind words, and everybody on this call and in this conference. So grateful for your efforts on our behalf to get the message out about a really important technology. Ondine is a resistance fighter. We're trying to tackle the major health issue of antimicrobial resistance, as you've heard from all these different speakers. It is a really big crisis. And to put one statistic really on the map for us, 1 in every 2,642 Canadians will die of an antimicrobial resistant infection this year. And in the next 30 years, it's predicted that this number will change to 1 in 1,000, 1 in 1,500, or possibly even worse. We've just come through the COVID pandemic. And the COVID pandemic, in the first year, we lost 6 million people. Our experts are telling us that by 2050, 10 million people annually, year in, year out, are going to be dying for lack of the right drugs or therapies to help them because of this resistance issue. And this is truly a crisis. Ondine is hoping to bring some solutions. We've got 7 different products under development, mostly for the hospital, if you've heard about, also for burns and for wounds, for chronic sinusitis. And we're hoping to bring those into hospitals across the world. And we definitely need the help getting the message out. But photodisinfection is not new. It's been around 35 years. It was invented by Michael Wilson at University College London so many years ago, actually for Eastman Kodak, when they thought they might go into medical devices. And 25 years ago, Ondine licensed that technology and has been working on products since then. But what is new was COVID. We've never seen such a pandemic since the Spanish flu in 1918s really come by and hit our societies, our economies, our families as it has. And what's also very new is this focus on the nose. And I think this is the message today that this community of speakers and me personally are trying to reveal to the world, is that the nose is where we have to start, or at least include when we're thinking about pandemic preparedness. The incredible work and foresight of Jack Kolenda and Dr. Argemi, who were able to demonstrate and optimize a great new protocol, helped us, including, and the world to see that treating the nose proactively with an antimicrobial that is safe and non-resistant forming has important outcomes that can help our healthcare systems deal with pandemics, that can help our families protect ourselves. And when we get sick, we have a solution that can assist on a cost-effective basis. But it starts with the nose, and that's one of the key messages here, that the nose was linked to SARS-1 20 years ago. And in the pandemic, people seem to forget that literature. And Jack Kolenda read that literature and identified the link between lower virus loads and bacterial cofactors with fewer hospitalizations and fewer deaths, and decided to take this technology, which we supported, to a clinic to help people in Canada. And that's pretty exciting, because what they revealed and what they optimized in the field was validated by Dr. Argemi and his team, and also the Sunnybrook Hospital team, with clinical data that we think is robust and is worthy of attention. It starts in the nose. So when we are dealing with the next pandemic wave, when we're dealing with new emerging threats, we need, especially for upper respiratory, we need to think about cleaning the nose. We wash our hands, we brush our teeth, and now we're learning we have to do something with the nose. Why the nose? It's warm, it's moist, the airflow helps pathogens hide and flourish in there. And when we can reduce the viral load, the bacterial load, the fungal load, we tend to be healthier. And we need to look at that. And that's the message today. And I'm very grateful for all the speakers, the doctors, and the patients, and the people on this call who gave this technology a real shot and have helped the world learn about a really new, important approach to patient safety. And I thank you for the time. And Rod, thank you for hosting this very informative session. Thank you. Rod, you're on mute.
Information at luxvitaeworldwide.com. Oh, I'm on mute? Oh, am I muted? I don't have a button. Oh, okay, there we go. Can you hear me now? There you go. Thank you, Carolyn. I didn't even have a button. But I did want to say thank you to you all. Should point out that if you have interviews for any of the press, some requests for any of the speakers today. By the way, nobody here today got paid for this. This is very important because we all are absolute believers and we've all been treated successfully with Steriwave. But you can go to the luxvitaeworldwide.com. I think we're going to put it up on the screen. Go there. Make the requests for anybody on the panel. And Carolyn and Nick, if you can just hang on here. I'm not sure what the screen looks like. Jack, maybe you can take us with Jay through how a treatment, this is how we're going to end today off, to show everybody how Steriwave actually works. So I'll let you just grab the mic and we'll take you through it. It's only going to take a couple of minutes. And thank you everybody for your time today.
So we've heard all about it. So now we can actually see it. And Jay actually is going to be the volunteer. He's due for a treatment anyway, so we're going to do that. So there's 3 components to this. So the first component is the actual laser unit. And as you can see, it's a very sleek device. It's got the ability to be wiped down if you're using it and you want to basically clean it after its use. And that's very important, especially in the hospital setting where you have patients that can be in isolation. This unit actually comes on a standard roll, so it's very portable. We don't have that here right now. The second component is the actual methylene blue. You have these little capsules, and you'll see how that gets used in the nose. And essentially use one of these per nostril. And then you have the delivery system. These are sterile packs, and they're per 1 treatment. Okay, so we'll take you through this.
Hold the mic and you can do it.
Okay, great. All right, I'm going to stand up first. So, we're going to take the capsule. Oh, very important, Kleenex, because this will run. So there you go. Okay. So as you can, hopefully you can see this. You can see that it's blue. Jay, just go up. And what you do is you just essentially insert this in the nose. You want to go as far up the nose as you can, and you want to have a nice coverage of the nostril. So as deep as it allows you to go. So that's 1 application. Now we're going to take the second applicator and we're going to insert it into the second nostril. And you can see you just want to basically get a nice coverage. And Jay is very good. He's very experienced. He doesn't even move. That's excellent. Once we do that, then we will connect our applicator. And this is very simple. And the simplicity of this allows the users to actually apply this. Once you turn it on, the laser comes on. I will insert this into the nostril, and I will have Jay participate in holding this. Excellent. And then we just turn it on.
And I'll let you have this.
Oh, great, thanks. Just 1 sec, just warming up. What's that? No, it's connected. Just hold on. Should be running right now. So here we go. And as you can see, a nice little circle, and that's the timer. And so essentially, it times it for 2 minutes. As the time lapses, you will see that the timing circle decreases. And once this is completed, that's going to be 1 cycle. And so you can run several cycles. Now, in between these cycles, you will reapply the methylene blue to the patient. And it's pretty simple.
You can see how it lights up his nose.
Yes, you look like Rudolph. Usually,
Carolyn and Nick, do you want to add anything?
I thought that matched much of what we've seen in in healthcare environments, in pre-surgery areas, in tertiary care systems. I've never seen it used in an ad hoc situation like that. But you'll notice that the amount of light is not dangerous. There's no pain involved. It's designed to be extremely rapidly applied, and those pathogens that are in the nose are being targeted by that blue-colored agent and stained specifically rather than the human tissue, and the light is activating that chemistry, causing this free radical flux, this singlet oxygen flux, which then kills the microbes. And it does so very rapidly. As you see, that's a 2-minute timer. And it's designed really to be plug and play, press and forget, and allow the patient to then proceed into surgery in a way that's much more protective than if they were not decolonized, or they were decolonized by antibiotics, which could be resistant and you would never know.
Nick, can you comment on future developments and how this technology is going to move forward?
Sure. Thank you, Dr. Kolenda. Within the boundaries of what's publicly disclosed, we are a public company on the AIM market in London, but within that boundary, I can tell you that the technology is moving in a direction of clinical study in the United States, where we have just completed a phase 2 study and we're moving into a phase 3, hopefully. We have a extensive development program that is moving the technology into other indications. For example, we have deployed in a significant phase 1/2 study in the sinus cavities, where the technology is being used to eliminate the microbes that are involved in chronic sinus disease, proving very powerful there because of the activity against both bacteria and fungus. We've looked at the technology inside the United States against ventilator tube microbes. These are the microbes that drip down into the lung from ventilator tubes that are otherwise contaminated by the patient's own breathing, own respiration, and often cause a rather dangerous condition called ventilator-associated pneumonia, a big killer in intensive care units. We're looking at how the technology could be deployed in burns and wounds, and certainly any area where we can access topically an infection which might otherwise be treated with antibiotics, which may in fact cause resistance. But the first and primary indication for us is in the nose, where we are now developing other techniques. We today saw you use a particular fiber optic assembly, a particular device that is a one-time use device. We've miniaturized that into a much smaller unit that can be created, manufactured, and then disposed of much more easily than that big fiber optic unit. So in addition, we're moving, as I think Carolyn indicated earlier, in a direction of a handheld device. We see this as applicable across the entire hospital spectrum of care. So rather than just simply right before surgery, we may wish to block patients before other procedures, indeed even prophylactically. And that's before we start talking about healthcare professionals themselves who may be involved in a communication chain, especially of MRSA, to patients and to the environment. So just a really exciting time for us, and almost unlimited set of opportunities. Our job is to make sure we finish one or two of the really big ones, and we're doing that right now with our partners at HCA Healthcare in the United States, as well as developing further in the UK and the EU and other countries.
Carolyn, you've seen it used many times, I'm sure. Maybe a last word to you about witnessing our little demonstration as well. And Jay, again, has been treated almost daily.
We in our family are also regular users of this technology. We also have some health challenges in our family, and this has been absolutely a spectacular new protocol. So very grateful for Dr. Kolenda to champion this, to take it out of the theory and into the practice, optimizing it, and then getting it properly researched and clinical trials through the incredible team at the Clínica University de Navarra in Pamplona, Spain. Dr. Argemi and his team with Dr. Alejandro Fernandez Montero and Dr. Jose Luis de Poza. Extraordinary team behind them. The Sunnybrook Hospital group that starts with Dr. Carrie Wine, Brian Wilson, Leila Perez, a huge team, including at University of Saskatchewan behind them. The Vancouver General team that put this on the map way long before coming into the 11th, 12th year, led by Dr. Elizabeth Bryce, Titus Wong, Diane Roscoe, Dr. Baz Masri, Dr. John Street, Sheila Weatherall, and a huge team behind that. These are significant teams of people that have done superb research and that have looked at and demonstrated the safety and the efficacy of this technology. It takes teams, it takes communities, and it also takes people that will champion the technology. And so when I look across the spectrum of the people on this call, Doc McGhee, you're going to end up with a real doctor certificate here. Thank you so much for your time and today I am grateful for your generous donation to VGH and the whole KISS band for their sponsorship, their support of the technology, their enthusiasm, their use of it. It means so much to have this kind of endorsement, and that you would come on this program to tell the world that you believe your users and you found the protocol to be valuable. The doctors on this call that have championed the message and the use, the technology, the data. Very grateful for everyone, and the people who came on to say that I've used it, Jay, Elizabeth, Pinball, and Gary, among some of the other people. Thank you for your time today and for sharing your personal experiences and your heartfelt support of the technology. It is a great technology, is worth championing. And as Nick says, this is an asset of humanity. It's not about Ondine. It's about a new modality that we have to think about and champion sooner rather than later. The world is going to be hit with increasingly more emerging threats. Those threats are killing more of us, and we have to take it seriously. We have to be smarter. We can't wait so long for new technologies and solution to become standard of care. We have to work together for the betterment of mankind, not just in the first world, but all lower income people as well as wealthier people around the world need to have access to the proper medicines in the face of a really major threat called drug resistance. And so on that, I'd like to leave the note of just gratitude and thanks for everyone today on this call.
Yeah, great words. We spent a lot of time today, I think longer than we thought we would, but you know, you could probably talk for 24 hours or more, or days, because it's such an important breakthrough. Jay, maybe you could just tell everybody who was watching, you just had a treatment, you've been doing it for a while, you're used to it, what it feels like, how you feel, et cetera, et cetera.
Yeah, like I said, I do this treatment every day, sometimes twice. I believe in it so highly, and that's proof is in the pudding. So after a treatment, no, it feels non-invasive, like everyone's been saying. It feels fantastic. It actually feels really good. It's nice and cool and massaging in the nose, and it's also a severe peace of mind knowing that you are that protected. And then once it's finished, you just feel almost 101% normal. Nice. Again. You just want to get going.
Well, thank you and to you and Joe, Elizabeth, Dr. Kolenda, our great speakers who were here. Again, I come by this, I guess, selfishly, because being a broadcaster and a journalist, you ask questions. And when I first heard about this myself, I will tell you that, I'm paid to be skeptical and be curious. And I was looking for all the answers. I was trying to find out, does this thing really work? Is there a placebo effect? Yada, yada, yada. And I can tell you, the more that you dive into this, the more that you learn about this, the better your knowledge becomes, the more knowledgeable you become about how great this is for the world. So, Doc, I know KISS is traveling across Canada, traveling across the world. I would say, for all of those people out there who have tried this and are proponents of this, be like KISS, shout it out loud, right? Tell the world, because we need to know more about this. More people need to, if they're sick, they need to get treatment. Doc, where's KISS playing across Canada? When does the tour start?
We'll start in October. I don't have the exact dates, but we start up in Vancouver and we go all the way across Canada, and then we end December 2nd at Madison Square Garden. Be the final shows of KISS. And we couldn't do this without Carolyn and your technology.
Wow.
And we couldn't do it without the team behind Ondine. We've got the most amazing, passionate employees that are making the magic happen and supporting this technology, and very grateful for all those behind the technology, not just me and Nick.
Mm-hmm. Well, you're going to be saving a lot of money in the medical industry down the road. You're saving a lot of lives. You're helping change the world. We'd like to thank everybody worldwide who was joining us on the stream here in Toronto as well. Thank you to all of our guests today. Again, if you have any questions, you want any interviews with anybody who was speaking today, please go to that website, luxvitaeworldwide.com, and we will make sure that you can speak with them. Thank you for your interest in this today. Thank you to Ondine. Thank you to Steriwave. Have a great day. Have a great week, everybody. Please stay safe.
Thank you. Bye.